Good afternoon, everybody. Welcome to Webinar 3, Technology Trends, Innovation, and the Future of Home Health and Hospice. Welcome and hello, everybody. I'm Jennifer Maxwell, co-founder and CEO of Maxwell Healthcare Associates. I'm here again with our panelists, Jay Duty, COO of Maxwell Healthcare Associates, and Cory Mertz, managing partner with Mertz Taggart. Welcome, everyone, to this webinar series focused on mergers and acquisitions in the home health and the hospice sectors. In our previous episodes, we've explored the critical importance of the evaluation process for organizations preparing for M&A. We also discussed how thorough evaluation not only identifies strengths and weaknesses, but also helps organizations present themselves favorably to potential buyers. Our conversations have emphasized the necessity of aligning clinical quality and market expectations, as well as the importance of technology and integration and cultural fit in ensuring successful mergers. As we continue our journey through the complexities of M&A, we will focus on emerging trends, technological innovations, and strategies that can enhance organizational readiness and drive successful transactions. Thank you for joining us, and let us dive into today's discussion. Let's start off with both of you taking a look into your crystal balls for us. What future trends do you foresee having the greatest impact on M&A in home health and hospice sectors? Jay?
Yeah, thanks, Jen. Appreciate that. I think this is a little bit of a crystal ball, but it's also kind of happening today. What we're starting to see is technology and the integration of technology with the people and process was kind of a nice to have. We talked a little bit about this on our last webinar, but I think people are really learning how to integrate this into kind of their regular operating platform and looking at the integration of that technology to really increase and enhance the efficiency of their operations. Then I think there's the whole other side of the patient care piece where there's technologies that have really taken off, telehealth being used. COVID kind of like really helped us get into the use of telehealth and helping us have more touch points with patients. I think that's going to really drive things. Of course, AI, and I think that's something everybody throws around all the time that, oh, we're using AI, but how do we specifically find use cases for that? Automation of processes and things that we see in our own operations, I think are going to be not just, again, the nice to haves, but people are really having to learn how to do more with less and how to have more efficient throughput by rather than just throwing people and time at it. So how do we utilize technologies to do that on how care is delivered and managed? For instance, I think predicting, AI can look at historical data, predict that behavior of the patient either clinically or a process operationally. And so as we shift towards those digital health solutions, it's really going to allow organizations to expand their reach and to engage with patients to a greater degree, engage with caregivers to a greater degree, engage with employees to a greater degree. So I think those are all things from an M&A perspective that you have to now consider as part of the entire platform is what does my tech stack look like and what is the value? If I'm a buyer, what does the seller have? Or if I'm the seller, what is going to be attractive to the buyer there too? So I do think that's driving, and we're seeing more and more integration of these technologies just every day. There's a new process that's been implemented, or some efficiency that's been achieved through utilizing AI or automation or other technologies.
That's awesome. Cory?
Yeah, I completely agree with Jay. It's all about the data, but in addition to that, having the scale and the ability to collect meaningful patient data and then do something with it. Just as an example, I think this past spring we did a survey. I did a survey with 51 strategic buyers in the home-based care space, home health, home care, hospice. I personally conducted these interviews, so it took up a good part of my first quarter. But but I found it insightful for us and for our clients. And if you're ever having trouble sleeping, it's on our website. If you want a copy, you can just submit the request, and we'll send you a copy. But I think we'll do it again in 2025 and start looking at trends. Make it a little bit more of a series. But one of the things that I asked them about was their value-based care strategies. And, of the 51 buyers that we interviewed, a little over 80% of them, I think it was 41 of them, were at different stages of trying to implement some sort of a value-based care strategy with the payers, whether that be the MCOs, the MA plans, or the ACOs. Different stages. Some had already, well, roughly half of them, about 25, already had some sort of value-based care arrangement in place. And they took a lot of different shapes and forms. Some were PMPM arrangements. Some were similar to, what HHVBP measures, with more of a metrics-based upwards, downwards adjustments. And some where they're taking on risk. So a lot of different models that are being developed out there that are, to me, they're all interesting and fascinating to watch. But what's also interesting is, another 30%, or about 16 of them, and these are all pretty large strategic buyers out there. They are either in negotiations with, trying to implement something with one of the payers, or, they just don't feel like they have the scale and the data to get a seat at the table with the payers, to make a pitch for some sort of value-based care arrangement. So, what was clear to me and what they made evident is, big part of their overall strategy, which is driven by value-based care, is really getting that scale and the data. And most of them think the best way to achieve that scale and density and the associated data is through acquisition.
That's awesome. Thank you both for those insights. I really appreciate that. That's very interesting. I look forward to seeing this series of potential surveys. So it'll be interesting to watch that trend over the years. So thank you for that, Cory. Now let's take a deeper dive into technology and innovation discussion, and let's talk about AI and automation first. Jay, you mentioned it a little bit earlier, but in your experience, how has AI and automation influenced operational improvements in our industry?
Yeah, we're seeing this a lot on the consulting services side right now. As I mentioned, obviously people are trying to figure out how to do more with less or make their human capital more efficient. And so I think it's kind of two veins. I think there's the administrative side of things, or back office or operational side, and then I think there's the clinical side where these are being utilized. Example, a lot of AI algorithms are optimizing how we adjust staffing assignments and reduce operational costs. I think those solutions are also helping us provide the right person to be in front of that patient, to get better patient satisfaction, to be more efficient with that. Maybe it allows the person that's in the home to really be providing more tailored care with some clinical decision support there in front of the patient than we might not have known before. I think we also know a lot more about that patient to their home that we go to, whether at home health or hospice or private duty. We know a lot more about that patient when we go there, so that we can be really targeted with good information and clinical data support and decision support tools to do that. And I think analyzing that patient data and helping, we'll talk a little bit about the predictive side of that, but automating processes where we can get to can we admit the patient more timely? Can our timely initiation of care be sped up by that automation of intake, scheduling processes, those type of things? Really, the blocking and tackling in the back office of these organizations, these agencies, too. So I think the patient care will be improved by that, but also just really streamlining the workflows that we can really make sure that let's use the technology and the automation and AI to really maximize that clinician working at the top of their license when they're in front of the patient. I mean, that's the most valuable asset we have, right, is putting that caregiver right in front of the patient there too. And I think that'll make organizations more appealing to buyers, because there's an efficiency there of utilizing those tools to really deploy the people appropriately there too. And again, I think there's a whole other side of predictive analytics that we'll talk about here in a little bit. But how do you automate processes to really maximize what those clinicians are doing most importantly, which is spending time with patients?
That's awesome. Thanks for that, Jay. Now I want to take it a little bit farther and tell me what you're seeing with trends in telehealth and remote patient monitoring, and what are you seeing as the most promising enhancements for patient care in this area?
Yeah, thanks, Jen. You may get some hot opinions here, so I'll couch that early. I think there's definitely a place for that. I think in COVID we really got opened up to more of these options where sometimes telehealth was the only way that we were connecting with patients. There too, and the proliferation of that with payers and even Medicare allowing those interactions really helped us get touch points with patients and really give them access to care. And I think that's continued today. Patients that are in rural or underserved areas or people we just couldn't get to were affected by that. But now it's really expanded into how do we have a touch point with the patient when it may not be actually sending a nurse or a therapist or an aide into their home, but how do we increase that communication with patients and the agency, and then utilizing it in the adherence to the treatment plans. Like what are we doing to educate the patients, have a touch point, make sure that they're taking some responsibility in their own care and enhancing their overall outcomes. So I think telehealth has been, really helped with that. And then remote patient monitoring technologies, wearables have really made a proliferation. And what I think about that one, and there's a lot of opinion kind of wrapped up in this one, is, a lot of those things are tough to deploy, right? You've got the expense of putting in an expensive device, and you've got the blood pressure monitor, and you're doing a pulse, and all those different kind of tracking mechanisms that we're then asking the patient to be the one to report back, maybe a scale, those kind of things. That can be really tough because then agencies become equipment managers, and they become a warehouse for those. And how do we deal with the infection control of those? So definitely have a place. There's an expense there. I think on remote monitoring technologies, it's really about picking that right patient, and that's where it ties to the data. Is how do we pick the exact right patient for that to have impact on, say, preventing rehospitalizations. But where we can use, how do we enable proactive management of chronic conditions and support better patient care through this data and this transfer of information. And I think the important part on remote patient monitoring activities are really, what do you do about it? So it's kind of the so what factor. Like, that's great, but whenever I have a piece of data that tells me I need to react, what do I actually do to be in front of that patient or connect with that patient? Gives us some good insights, but it may help make me to make a decision. Okay, I need to get somebody to that home, or I need to call this patient, or I think a lot of the troubles with it can also be, did I get a false positive? Did a cat walk across the scale and throw off a false positive? Or we heard a funny story about a 30-pound weight kept coming on for an RPM patient over and over again, and they found out that the grandson, who the grandmother who was watching during the day, loved to get on the scale and see the numbers that came up. And so every time they would do that, it would throw off a decrease in weight. It gets reported back. And so, I think some of that gets very complicated. And Jen, this is where you're getting kind of the hot take there. What I think matters is, how does the patient feel? How does the patient report to us how they feel? And what's the intervention that we need to do when we learn from that information? And so we've actually developed a technology called Nana Connect that simply just asks that patient to report back to the agency how they feel. So a scale of 1 through 5. So, if somebody's a 1, if you call Nana or Papa, so it's called Nana Connect. But if you call Nana and she's like, I don't feel very well today, well, somebody needs to get on the phone and call Nana, or we may need to send somebody to the house for Nana. So I think the thing about those technological interventions is, okay, well, how do we have the human intervention behind that supports the care of the patient in the home? So I think those have a place. I think the payers have allowed for those to have a place for sure. But also, how do we use data to select the right patients to deploy those technologies that ultimately drive to better patient care by selecting and choosing how we deploy the human capital and the caring side of taking care of those patients there too. And then what do we do with that data on the back end? So a long answer to a short question, Jen. But I do think those have a place, but I think it's got to be measured with, like, great, we've got information, we've got data coming in, but what intervention and what do we do once we have that information?
That's super interesting, and absolutely very promising for post-acute care delivery in general, right? I'm sure we are going to continue to see the evolution of how can we leverage how a patient feels along with that data to really be able to deploy the right type of care at the right type of time, right? So as we round out kind of like this tech stack kind of discussion, How do you see the role of the EMR and its impact on a potential acquisition? Cory, let's have you provide some insight from your position.
Sure. Yeah, I would say, both the EMR that you're using and how you're using that EMR are both important, both significant. So we work in the lower middle market. Most of our transactions have an enterprise value of, let's just call it somewhere between 3 million and maybe 50 to 100 million. We've done a few that are larger, and I say that for a reason. 95% of the time, at least with our transactions, the buyer and the seller are on different EMRs, right? You find that, and it's really based on size. The big guys, they all tend to migrate towards one, maybe two different systems. The smaller providers, everybody else, tends to use everything else. So, most of our deals, include a change in EMR, but even when they are on the same EMR, they're running in a lot of cases very different instances of that EMR, and they've customized it, semi-customized it to their liking. So even if they're on the same EMR, it's not necessarily a layup that you're going to be able to just tuck that in and plug it in and go. So how they're using that EMR is important. And, what we find is that the smart buyers, regardless of what system they're on, but especially if they're on a similar system, they're open-minded about what the sellers are doing. They're really doing what they can to try to identify and capture best practices from some of these others, and they're not so rigid in how they're doing things. So I think that's kind of interesting. I think it presents an opportunity for those types of buyers, for sure.
Yeah, and Cory, I'd just add to that. We've talked before. I've seen it. I've been on the side of, as a development person, looking at an asset to buy. That's one of the first questions you ask, and the reason you ask that question early on is it's not just the cost of that, although the cost of the software, could be pretty significant, and you need to think about those things whenever you're looking at an asset to buy if you're on the buy side. But it's also that how do I integrate into the culture? How do I integrate into, like your point was great about there may be same EMR, two different instances of it, maybe used totally different from a process standpoint, from a workflow standpoint, from how they've got it set up. So how do you integrate those two, I think, is the other thing. It's not just the cost of the software, but how do you go full plug there for our implementation services and our strategic integration plan. But that's what we find a lot on the consulting services side is, hey, even if they're on the same EMR, how do we make that kind of one instance and one cohesive process and functioning, role of where both may be doing it really well, but we had a client recently who there were a lot of best practices on the buy side, best practices on the sell side, and they asked us to come in and look and say, hey, out of all of this, what is that kind of like that third option of taking the best of the two operations and making sure the EMR functions with the people, process, and technology factor there too. So, we encounter that all the time. That's a great point.
Yeah, and I think we're seeing more buyers be more open-minded about some of these things. They're not as rigid as they were 5-10 years ago, where they had all the answers. I think they're really doing more, generally speaking, to really squeeze the absolute most strategic value, out of these opportunities. But so in practice, we talked about the big systems, and then kind of everything else and everybody else, all the other different EMRs that are out there, and there are a number of them out there, and a lot of good ones. But when we take a company to market, we're going to spend probably a good few weeks, putting together a few weeks or a month or so, putting together comprehensive offering memorandum, very comprehensive data book, with all historical financials month over month over the last, 3+ years, operational data month over month, for the last few years, KPIs, ratios, month over month. And, this is, the systems that can accurately report, this kind of information via a click of a button. really helps us, when we're taking a company to market, pull together a credible, comprehensive package that the buyer universe can really sink their teeth into and trust and feel good that the information is accurate. And by the way, and this isn't just a function of the EMR that you're on, right? Some have better reporting than others, but even those that have very good reporting, it still depends on how you're using it, right? It's garbage in, garbage out. So
Yep.
I'll say one last point on the EMR. If you're an owner or a potential seller, and you're considering a switch to an EMR, and you're considering a transaction, within the next couple of years, I think the first question you need to ask is, first of all, what impact will this have on EBITDA, right? It can be disruptive to operations, but what impact might it have on EBITDA, because that will ultimately impact the enterprise value.
Yeah.
But also, what can we do? Can this other system enhance our existing not only operations but reporting? And what impact might this have on my ability, if I switch, to pull credible historical financials and data?
Yeah, yeah. And Cory, I would say also you shouldn't shy away from, like, it shouldn't be a deal breaker if you're a buyer and you're looking at a seller and they're on a different EMR, or either way, you shouldn't be discouraged as a seller. Well, I'm not on EMR X, because it can be done. That's what I want to make sure everybody says, is don't check that off the list of, like, well, we couldn't join forces with that organization because we're not on the same EMR. It absolutely can be done. In fact, it may be a really good way to integrate those, because it allows you to kind of tease out processes and technologies and understand that, and really, you end up training, even if, like, sellers on A EMR, buyers on BMR, it may be that when we train, even if we stay with the EMRB, everybody that's using that EMRB may actually become better users of it, because we then train it and make sure that it workflows correctly, and then they maybe get some extra education on that implementation process. So I just want to make sure we're clear that on the EMR side, that doesn't just throw the deal out. Don't throw the baby out with the bathwater. That absolutely can be a hurdle that can be jumped. You do need to consider, to your point, what are not only the costs behind that, but what's the cultural and operational implication of bringing that together too.
Yep.
Right. Great feedback on that. So taking that EMR, we talked just about leveraging data. Now I want to add leveraging data and predictive analytics together. What are you seeing as organizations are working to understand their data? I mean, we know that they're trying to do that, understand their footprint and how they're going to apply that to their strategy. How can sellers best leverage data strategies prior to going through an M&A process? Cory?
Yeah, so there's definitely not one size fits all here. It does depend a lot on the size of the company and the resources you have access to. Like, everybody has access to data. They're just trying to figure out how to capture it, and then the meaningful data, and then what to do with it. As a seller, as an owner of a let's just say a lower middle market agency, I think it's important to always keep your eyes open for the best tools that are out there, that might be suitable for your agency and your size, so that the buyer can get the best understanding of your data. But I would say over the last few weeks, it's kind of interesting. I've been at 2 national home care conferences. We went to NAC, or NOC, however you want to pronounce it, formerly known as NAC, and HCAOA. And I must have seen, walking through the exhibit halls, I don't know, 15 or 20 brand new, AI-based software or service providers exhibiting. I couldn't tell you what most of them do. I suspect it's a combination of one or more of, it'll help an agency, grab additional market share, grow revenue, right? Lower cost of care. We're seeing a lot of AI assistance, with these clinicians, which help connect clinicians with documentation and hopefully make clinicians happier and more productive. And then finally, achieve better outcomes. So, and it's always one of those three, right? And all really with the eye towards enhancing companies and their value-based care strategies, right? So a lot of these companies, have received growth funding. If you talk about, transactions that are happening out there, a lot of them have received growth funding, either from angels or venture capital or even private equity. Some are pre-revenue. Most are not turning a profit just yet. Statistically speaking, most of them will probably fail, but it's exciting to see all the different opportunities and solutions out there. It's hard to manage, so to try to stay on top of it. But I would just suggest, if you're an owner out there, just do the best you can to try to stay on top of what's out there, and might that be something you can use in your agency.
That's great. Jay, do you have anything else to add to that? Like from a strategic solution partner or, a consulting firm to help kind of navigate that, what sounds like we're getting flooded into our space, a lot of technology options.
Yeah, I think the technology side and the data side, to Cory's point, people have a lot of data. What do you do with it? How do you organize it? How integrous is it? If you think about this, if you haven't been through the selling process, just keep in mind that buyer is going to come in, and that's how they do a deep dive to kind of evaluate. They only know what they see in the data, right? They're going to observe that at some point, but you need to have good, clean data so they can help kind of make decisions and understand who you are. So I think the better data management that you have, that can really lead your buyer into some informed decision making to really understand who you are, what your operational efficiencies are, maybe some areas for improvement that the buyer feels like maybe they could come in and get some value by being a partner in an acquisition, to integrate that into their current operation. So I think you've got to make sure when you're looking at it from an M&A perspective that it aligns with your M&A objectives, to make sure you're really getting the value out of what your operations are by being able to see it in the data. And so, I think also data is an asset, right? So if you're doing a really good job of monitoring your KPIs and some of your operational effectiveness, that's really going to give that buyer a really good firm look into, like, hey, this is a really well managed asset, or hey, there's some really good quality here. And I think it's not just about efficiency, it's definitely about getting a vision in the quality, and that, to Cory's point about value-based care, that's really now monetized. And then you've got to really be conscious of that. It's not just a nice to have, like a marketing flyer to say we've got really high quality. I mean, that's actually affecting your financial performance. And so how are you looking at all those different aspects with a really good data platform? So the more you can have that buttoned up to paint that clear picture for the buyer as a seller, I think the more effective and the more value you'll be able to show whenever that transaction actually happens.
That's great. That definitely good information for sellers out there. Now that we talked about the data platforms and that, now let's take a little bit of time and Jay, let's talk about, how does the role of predictive analytics play in shaping future growth strategies? That's a big buzzword out there.
It is, and it's one of my favorites, because it's, I think, again, and I reiterated earlier, what care do we provide in front of the patient is what matters, and how well informed can that be? And so, I mean, predictive analytics, of course, it's been around for a while, but I think it's now become kind of culturally integrated into how we provide care to patients, and that's what excites me about it. I think it can help us identify trends and forecast outcomes. There's a lot of different, ways you look at that, but predictive analytics, machine learning, making sure that data is giving us some really important decision-making tools, like predicting how many visits. Like if you look at Medalogic's Pulse, they're looking at how many visits are appropriate for this patient that looks like this demographic, that when we get that clinical information upon that start of care on the home health side, what do we know about how that typical behavior, and what can the machine learning teach us about the appropriate amount of visits to make sure we're getting that care? On the hospice side, looking at predicting analytics to give us a really good picture of when do we think that end of life is, and how do we deploy resources towards the end of life to make sure that we're providing really wonderful care for the patient and their family, but also that we're meeting our different, SIA measures and different things that are, asked of us on the quality side there too. And so, how do you use that to get operational efficiency, to get the right care at the right time in front of those patients there too, and it's going to provide better outcomes. I think it also gives us a lot of clinical information to understand that patient, and there's some new technologies coming out that are also going to help us look and see, like maybe they help us with the clinical groupings, that hey, there's a lot more there in the data that we've gotten from a hospital or from a physician or from some other referral source, that we can glean insights into that patient and the care they've received before and the chronic conditions they have. Well, how does that tailor how we provide that care, or maybe even bill that care, or maybe even give us clinical insights to intervene with treatments there as well. And so I think that a lot of that helps to understand the patients and provide clinical care. I also think there's a way to kind of tailor marketing strategies towards, hey, this is how we, deploy a protocol or have a pathway built into our system, because we understand what that patient looks like clinically based on the assistance of an AI, predictive model or machine learning to really give us value there. And that's a proactive look at providing patient care to, again, enable the clinician to do a really good job of giving, compassionate care in person to that person in their home in the post-acute space. And then how does that also tie into the competitive landscape? How does that help us grow sustainably so we can deploy our, again, important asset of the human capital side of a caregiver being by the bed? How are we the most efficient with that? How do we give the right care at the right time with the right skill level, those kind of things? And that really allows you to drive value to your patients, to your referral sources, and even to your employees. I think that's a satisfier too, that employees they want these tools. If you talk to clinicians, those really help them understand who the patient is, that even beyond just what they observe in the home, because they've got a lot of data and information at their fingertips there. I could go on and on about it, but I think there's a lot of value there, and the real value is, how do you put that human in front of a patient that's the most informed and has the best picture of that patient clinically, so that they can be well informed and go and provide the best care possible.
That's really great. I mean, you talk about kind of like that culture support as we get to predictive analytics and machine learning. I think the trend now is that clinicians are more in support of it. It's, Dr. Andy Mayo, who is one of our pivotal people in helping us develop the Muse product, which was on the hospice side. He called it the fifth vital sign. Never do we take away a clinician's skill set or denounce their abilities to know what position their patient is in, but to give them extra data to use, like to your value point there, to drive better care, right time, right care, right?
Yeah, that's good.
Go ahead.
I'm sorry, I thought of one more as we were talking about, there's a new technology, Hospice Dynamics is looking at a predictive length of stay on the hospice side. Very helpful in, cap issues, like what are you looking at from a financial perspective, but also helping identify that end of life so that you can deploy care and assets too. So I think that's another idea too, is it's not just the clinical care, but how do we look at those, like the cap issues in hospice, to make sure that we're preparing appropriately to provide the right amount of care to that patient, and then look at my panel of patients as a whole and really determine, is that driving cap issues up higher based on the individual specific patient needs, or where is that appropriate, and where maybe does that need to be tailored to the care that patient needs. So just that popped into my mind as well.
No, that's great. Right. So, talking about driving value, let's, as Cory mentioned a little bit earlier in our conversation today, value-based care. And as we look to the future, let's kind of discuss some of the implications of value-based care and changing of those reimbursement models. I know as we look to sellers to prepare and shift, as you mentioned earlier, Cory, towards that value-based care, and how does that really impact the process of M&A and the strategies that a seller/buyer would even choose to pick? Cory?
Yeah, so we talked about value-based care and the importance to it to having a value-based care plan for the buyer universe. That obviously has a trickle down effect to the seller universe. Um, I think it's important when we talk about value-based care, just kind of having an understanding of really what is value-based care all about. And to me, the way I look at value-based care, it's really about achieving a balance, between running your agency efficiently and cost effectively, while also having excellent patient outcomes, right? So it's a balance. And Organizations, agencies, in my opinion, you have to invest in training your staff, your clinicians, and the folks in the office, to make sure they really understand the value-based principles, right? And they're integrating those into their daily practices. So I think you have to establish that culture first, make sure everybody understands what it is and how they can impact it. But then, beyond that, then I think I mentioned the tools earlier, right? The 15 or 20 different groups that were out there offering different solutions, and as an owner, I think you need to really look at as many of them as you can. But then the question is, what can I afford, right? Um, Most sellers, if you're thinking about enterprise value, which is typically pretty important to the seller universe, what can I ultimately get for my agency? You don't want to implement something, a piece of technology, for example, that's going to be expensive to implement and use. That kind of defeats the purpose of delivering cost-effective care. So whatever tools or systems you adopt, in my mind, from an M&A perspective, you should look at it from an EBITDA perspective, and it should be EBITDA neutral, worst case, right? If it negatively impacts your EBITDA, then it's probably not the right tool to implement right now. So ultimately, a lot of these tools that are out there, it does become difficult for a lot of the smaller providers, to implement or adopt some of this technology. And guess what? That's okay too. That's fine. As long as you're adhering to that value-based decision making. If you can't afford the tools, that in a case, if we take a company to market and, our client can't afford some of these tools that their buyer has, the buyer's going to look at that as an opportunity, right? In the form of a potential synergy. So, I wouldn't feel compelled to try to adopt all of these tools. It really needs to make sense, from an EBITDA perspective. And if it doesn't, that's fine. It's an opportunity more than likely for the buyer.
No, that's really great to say. I know we work with a lot of people who are looking to sell, and they do want to invest in that technology. And one of the things that we've told them is look at your low hanging fruit, right? If the technology can pay for itself quickly and hit your bottom line, those are the technologies to be paying attention to, right? Because that increases the value of the organization, it increases efficiencies, it gives you more data to work with and be able to paint the picture of the organization. So, looking at those ROIs, I feel is really kind of, step one too, right? Or 1A, Cory, when you think about all the technology that's out there. Jay, do you have anything to add to that?
Yeah, no, I totally agree with you. And one of the things, it used to be, again, I said this before, but a kind of a nice to have, right? That of course we want to provide quality care, and of course we want satisfied patients. Well, that's now, part of your, not only your quality and patient satisfaction metrics, those are your financial metrics as well. And so, I think, you look at value-based purchasing, or you look at the payer world where those things are really driving that in value-based models, shared savings, pay for performance, quality metrics, those kind of things. The ROI's got to be there, but you may need to deploy some of those strategies within there that focus on the quality metrics or patient satisfaction, or potentially even your financial and operational performance there as well. Like a lot of you take a look at some of the ACOs and those types of models where, providing efficient care at high quality is important. They may be squeezing home health agencies, for instance, on, providing quality care, but at a lower cost, meaning less visits. So how do you how do you perform for that, but also make sure you're still performing from a financial perspective as well, and kind of balancing that three-legged stool of cost, quality, and then patient satisfaction there too. And so I think you've got to really weigh that balance of, again, the ROI for the agency, but also making sure the juice is worth the squeeze. When do you deploy those to make sure that you're performing in those arenas too?
Yeah. And I would say one of the other you talk about stools in that process too. And I think where sometimes sellers aren't necessarily looking down the pathway is their referral sources, right? If there's an opportunity to increase referrals from a referral source because you have great data, that in and of itself becomes a massive synergy on the buy side, right? Like, so we got to, it's not just technology, it's not just your people, but it's looking at the full picture, right? Sales and marketing is still, we're in a business, but we're in a business of providing quality care. And if we can show that to our referral sources, those referral sources are going to continue to give you more referrals, right?
Yep.
So now that we've kind of talked about all of those things and we've talked about value-based care, these reimbursement models, how do you both feel how they will ultimately affect decision-making for acquisitions? I know that's kind of a loaded question, but Cory, let's start with you on that.
Yeah, I think, there's a lot of interesting, unique reimbursement models out there that we haven't even touched on. And it's going to continue to evolve and in a lot of cases include not only home health, hospice, home care, but other ancillary service providers. I think I mentioned in a previous webinar, I've seen models kind of go through this buyer survey where, they're wrapping around, primary care, HME, infusion in some cases, and really taking on a per member per month or risk-based model with with the various plans that are out there. That is next level type stuff in my opinion. I think in the short term, I would expect to see more of the MA plans, adopt a lot of and we're seeing it right now as well with a lot of the existing agreements that are out there, adopting a lot of the same elements as VBP, HHVBP, as kind of a stepping stone. So I think short term, I think you're going to see a lot more of that, where the plans kind of adopt what CMS is doing, which is, you see that all the time in healthcare, right? If CMS is doing it and it's effective and it works, then the payers tend to the other payers tend to adopt a similar strategy. So I would expect a greater emphasis on measured savings, and then beyond that, a greater emphasis on measured savings versus kind of metrics based and metrics based savings or indicators.
That's great. So kind of our last topic into today, the role of private equity, strategic buyers, and our trends, right? Let's look to the future of what's happening in M&A. Cory, what trends are you seeing in the private equity and strategic buyer space coming out in 2024 and into 2025?
Sure. Yeah. Now this has much to do with technology, but more overall trends. But it's interesting because it all ties back to value-based care. If you look at the home-based care, the publicly traded home-based care companies, historically, they have been kind of the considered the ultimate consolidators, right? Historically, looking LHC, Amedisys, Enhabit, Pennant, Addus, BrightSpring, et cetera, et cetera. And if I missed somebody, I apologize. But the pure play home care providers have always been, kind of the ultimate consolidators. So, what the private equity groups do, both large and small, is, they ultimately tailor their strategies, their growth strategies around, an ultimate sale to a publicly traded company, right? So, and most of the time, historically, that's the strategy has been, kind of just buying revenue and EBITDA in as many places and dots on the map as you can get. So that a couple things have changed over the last, let's just call it 4 or 5 years. Number one, the publicly traded companies are really no longer considered the ultimate consolidators, right? I mean, they're still an extremely important part of the M&A marketplace. As the pure play public company values go up, typically the rest of the smaller providers tend to follow suit, right? So seeing how they're performing tends to have a trickle down effect to values and everything else for smaller companies. So that's not going to change, right? That's going to continue, and but now, it's the payers who are the ultimate consolidators. So, for them, revenue and EBITDA, really don't move the needle a lot for some of these guys. If you look at United Health, right, who owns Optum, who owns LHC, they're trying to buy Amedisys. They're doing about $100 billion in revenue a year. By comparison, Amedisys, is their primary target right now, is doing about $2.5 billion. So, so why is the interest? Why is there interest in that? It's much more than just the financials, the revenue and EBITDA. I think there's a number of reasons why these publicly traded companies are attractive to these payers. But certainly one of them is that they see the value that home care providers, provide to their member population. So the payers, the ultimate consolidators have changed a little bit, but over the last 4 or 5 years, from the publicly traded home care companies to the payers. But the other thing that's happened is the debt markets have tightened, right, over the last few years. We've seen a slowdown in M&A. Buyers have been forced to become much more disciplined, much more discerning about the agencies that they will consider for acquisition and pursue. Some of the variables are, geography, financial performance, quality is certainly important. Quality outcomes are important. But they're more interested in, the buyer universe now. They're more interested in strategic fit than just filling out dots on a map, as I mentioned before. So, the bottom line is, so that all sounds negative, but the reality is, if the right buyer finds that right opportunity, where everything aligns from a value-based purchasing perspective, margins are clean, or where they should be. Those companies are still gonna, they're still gonna be willing to pay a premium for those companies.
Awesome. Yeah. Jay, what's your take on this?
Yeah. And Cory, I don't think it's negative. I think it's honest, right? I think that we were in an environment where, to your point, land grab, dots on a map. The idea was like, go get something that's performing financially, and I can integrate it into my platform now. And I think now that organizations on the sell side can distribute, the more they can demonstrate their commitment to innovation, quality care, efficiency, financial performance, they're going to stand out. No longer are somebody just buying up anything, but now it's really about the financial and clinical quality, operational efficiency in that asset. To your point, not just putting dots on a map to be accretive to the financial side, but they're going to have to integrate that too. And so I think that's an interesting trend there too. And I think private equity firms are looking for somebody that's got that built, that's got a good growth trajectory, that is driven by these technology-driven solutions and decision-making and clinical support, that has a great trajectory on, that can show growth immediately. And then strategic buyers are doing the same thing. They're wanting to make sure that there's some operational efficiency there that they can actually integrate to their platform, and really have to make sure that there is some quality care there, and that make sure that there is a commitment to operational efficiency there, and it's no longer just, I'll fix it and I'll go from there. So I'm excited to see that. We're seeing on the consulting services side that there are some transactions happening. I think into 2025 we'll see, a lot of that on some buying and selling, and I think that's exciting. I think we've had some kind of holding pattern and period, and people kind of waiting to jump. But we're excited about that on the consulting services side, because I think there's a lot of people that really want to do this the right way, really want to make a really good decision about what they're buying, and taking a really deep look and a diligence, or checking the health of that agency before they buy it. And so there's a lot of that activity that we're starting to see.
That's awesome. That's awesome. Such a great discussion today. We're coming up 10 minutes to the hour, and we've kind of gone through our major topics, but this discussion has come full circle on M&A and preparing for the future through technology, innovation, and knowing that that's essential for organizations in our sector. Embracing the trends can lead to improved operational efficiencies, as Jay has said, patient care, and positioning organizations for a favorable transaction. With that, I'd like to just open it up to the floor. If there's anybody out in the audience that has any questions for our panelists today, please feel free to put them out there, and are happy to have each of Cory and Jay weigh in on them. Looks like I have one here. This is, kind of maybe circling back on everything that we've talked to today. What do you guys feel are the critical innovations organizations should focus on to stay competitive in an M&A space? Jay?
Oh yeah, good question. So if I was prioritizing those, which I think is what the question is, like to Cory's earlier point, you can't do everything, you can't do it all at once. But I think really understanding what automation and AI can do for efficiency and for tailored and targeted patient care, I think if I had to force rank those, I would look at that. There too, I also think data analytics and all the insights that you can get from the clinical, operational, financial perspective. What we're seeing is that people have a lot of data and they're trying to figure out what to do with it. And they're trying to see what questions about my operations, whether it's efficiency or, clinical care, what is the data telling me about my performance in those arenas too? So if I had to stack them, and it's kind of hard to, maybe they're all just like barely under each other, but, AI is a tool, right? And I think it's really about AI to what end, to what purpose, what's the use case for using that AI and getting that information that AI and machine learning can glean from data sets, and then anything that can be automated that I've got humans doing that's in an inefficient way today, can I automate my processes or the way in which I move data around, the way I workflow patients through their life cycle through my system there too, and then again those robust data analytics capabilities. What do I learn about my own operation, the care I'm providing, the way in which I provide it? It's going to help me make some decisions going forward about how to be most efficient with my resources and time. So I think there's many more, but I think that's probably how I would stack the critical innovations that I think people need to steer towards.
Cory, anything to add to that?
If hasn't been clear already, I'm certainly not an expert on all the different technology that's out there, but and it continues to proliferate, right? So it's even harder to stay on top of everything. But I again, at the risk of being redundant, I go back to if you're an organization and you're evaluating something, whether it be an innovation, a service, or a piece of software, it really just needs to check the boxes. Does it enhance revenue? Can it make you more efficient? Can it improve EBITDA? And can it improve patient outcomes without negatively impacting your EBITDA?
Yeah, and I thought one more, Jen. The other thing is too, how do you enhance communication with your patients? I think that's been, you talk about a big key patient satisfaction driver. That in the home health and hospice industry, that's just been a gap. And so, my pest control service, when they come to my house to do my pest control service, I get pictures. I get a picture of the technician that's coming out there. I know that his name is Brad. Brad tells me everything he's going to do, that he's on his way, those kind of things. And that's a huge gap with the way in which we deliver services to patients, which is way more important than, keeping bugs, out of my house, and especially mosquitoes out of the yard. That's the big one for me. But, we know all of that. I know when my Domino's pizza is in the oven and that somebody's put it in the car and driving it to me. But when my dad was on home health services, didn't know that the therapist, whose name was also Brad, which is the same name I use for my pest control guy, but no relation, was going to be coming to the house to do his therapy. I didn't know that. It was a ring at the doorbell, and he may not have been prepared for that care. So communication with patients, both, hey, we're coming, and then once you're on there, how you feeling? And then, really letting the patients drive that patient-centered care platform to tell us what they need from our home health and hospice and home care services. I think that's a huge gap, and one I would like to see, the industry tackle to a greater degree. Obviously we've got some solutions for that here with our Nana products and making sure that we're communicating with patients. But that's kind of I think another one. We've talked about a lot about operational efficiency, financial efficiency, but not just the satisfaction of a patient. Well, I guess the number one driver for that, from what you see, is communication. That's what we hear all the time, is that I didn't know, and I wasn't able to get in touch with a caregiver, or whatever it may be. It's not just the patients. How do we wrap the family around in that too, and really, make us all rally around the care of our seniors, which I think is incredibly important, or pediatrics, or whomever we might be taking care of. But I think it's extremely important. I'd love to see the industry, tackle that to a greater degree.
That's awesome. Awesome. Well, we're just about to time. We don't have any more questions in our question box at the moment. I want to thank both Cory and Jay for being on this series and helping to navigate from a seller perspective and helping sellers understand where the trends are, the technology needs are, and really looking at their assets from a very logistical and transparent kind of lens that allows for the best type of transactional opportunities in their future. So thank you all for today, and we look forward to another series coming up on our 2025 trends. Thank you.
Awesome. Thank you.
Thank you, Jen.